Well, the U.S. coronavirus death toll has reached a devastating milestone, 500,000 lives lost. Health officials say that it won't be until the end of the summer before everyone can get a vaccine.
All right, so a doctor, though, at Johns Hopkins University believes the COVID-19 pandemic could be over much sooner. His name is Dr. Martin Makary. He's basing his opinion on data, published studies, and conversations with experts. We're excited to talk to Dr. Makary this morning. We need some optimism this morning. Doctor, tell us how you came to this conclusion, because the President of the United States and Dr. Fauci are not on the same page as you.
Well, some people are trying to set expectations because, as I was very clear in the article, COVID will be around for decades to come. But we've got a very promising piece of data that we have to interpret in some way. That is a 77% reduction in daily cases over the last 6 weeks. As a scientist, you've got to be honest and look at that and ask why. And it really cannot be explained by the early vaccinations. And I don't think there's been a sudden change in behavior. What's happening is that herd immunity has started to kick in. Now, herd immunity is not binary. It's not all or nothing. And what's happening is you've got 40 to 55% of the population now with some immunity. Maybe they had no idea they had coronavirus. Maybe they just have the activated T cells that give immunity and not the antibodies, which is what we've based our estimates on. And now we've added 17% of the U.S. population of adults has been immunized, and we're adding about 1.8 million per day. That was the number from yesterday. We could see really low levels by April or May of this year.
So what would that mean if we do reach herd immunity? And do you think everybody would get on the same page at that point? Or are they still going to, be predicting caution for a while?
Well, it's interesting. When people predict bad news and it's wrong by fivefold, people just ignore and move on, right? And then here you give some good news, and if it's not, perfect within a margin of 2%, then somehow people are upset. And the reality is that we're going to see cases probably in the couple of thousands, which in a country of 330 million, in my opinion, is good news. And loneliness is epidemic in the United States. It was epidemic before COVID, and it's been magnified, especially among seniors. And as a doctor, I can tell you it affects your physiologic reserves, and it leads to other health consequences. Kids are 10 times more likely to die of suicide than coronavirus. So I think it's good for us to start contingency planning right now. Most of the pandemic, it's been, hey, here's some data. Now let's scramble to figure out what to do. This is a good time to plan, and we can plan for a semi-open society very soon.
So, Doctor, you talked about natural immunity and T cells and the antibodies that some who have had COVID are able to build up. We still don't know how long those antibodies last, right?
We don't, but let's look at the data. And I go through several of these studies in this piece in the Wall Street Journal and in a recent piece in the Washington Post. People who survived the Spanish flu of 1918, they were found to have activated T cells 9 decades later. The survivors that were alive in 2008 were studied by 4 universities. It's amazing. These activated T cells made neutralizing antibodies 9 decades later. SARS and MERS, that natural immunity lasts for at least 2 to 3 years. There's been documentation 12 years later. And even when you don't have the antibodies, new research from the Karolinska Institute in Sweden, where they give the Nobel Prize, has shown that you're twice as likely to have activated T cells than you are to have antibodies.
Do you think we're seeing the true numbers of individuals as we see the numbers going down of cases? Do you think we're seeing the real true numbers? Because the lines are shorter now at these testing facilities. Plus, everyone's been sucked in by winter weather. So maybe we're really not seeing the numbers of those infection rates.
Yeah, and it goes both ways. The number that we think of have been infected, 28 million, probably represents 4 to 7 times more people than that. And I think what you're seeing, for example, in North Dakota, where the seroprevalence rates are north of 50%, is that you start seeing slowing. Herd immunity is not binary. When you get a lot of people infected, there are fewer people who are susceptible. And I think you just see natural slowing. That's what's been happening for the last 2 months.
What do you think about the vaccine rollout? I mean, we are missing vaccinations last week because of the weather. I got all of my Amazon packages on time, just so you know. But, they can't seem to roll out the vaccine. Now we find out Jones Beach, which inoculated a bunch of people last week, they didn't have the vaccines at a certain temperature. Now I think about 80 people have to come back and get revaccinated. Do we know what that means?
Well, I think we've got to evolve our strategy based on the data. We've done a really bad job with the vaccine distribution and allocation. We should be maximizing first doses. You saw the research that came out. They're 85 to 93% effective in the short term. Now, the second dose is good for longer durability, but we should be maximizing first doses before we give the second dose to save more American lives. That's been something that's been quickly dismissed by some of the old guard medical establishment. Also, those who had COVID already, they should get to the back of the vaccine line because they've got natural immunity. And finally, we should have a simple age-based allocation. Too many regulations, too many complicated tiering structures, that has resulted in fewer people getting it.
What about masks? Do you think once we reach this herd immunity, we're going to have to wear our mask every day for all day, the whole day?
You know, officially I'm supposed to say yes, but the reality is people need a hug and they need some connection now. We've got to rebuild communities. We've got to address loneliness. And so the reality is I think we're probably going to see a slow and timid removal of the masks. And understandably, people have seen a lot of carnage. And then the summertime will probably look like a very normal summer. And we're going to have to watch out for the fall. We're going to watch the variant strains in the southern hemisphere as we do with influenza. And we may recommend universal or selective masking for high-risk people or symptomatic people in the fall. The fall could look like what usually looks like a bad flu season with coronavirus, depending on the strain.
But a normal summer.
Normal summer.
Please, from your mouth to God's ears.
Okay.
Dr. Makary.
We're going with it.
Thank you so much. We appreciate you coming on from Johns Hopkins.